Well, good afternoon and welcome to our virtual dialogue with the Dean, bringing you hopefully some interesting information about things happening on campus and the college. Before we start, I just want to remind everyone, if you have questions about anything we talk about in the video, please feel free to leave us a comment and we'll come back and respond to your questions. Today, we have with us Dr. Jerome Adams. Dr. Adams is the former Indiana State Health Commissioner, and those of us in Indiana are familiar with him. More recently, he has served as the 20th U.S. Surgeon General, and recently, then even more recently, joined Purdue on October 1. So it's just been about 2 months, hard to believe. He is serving as Presidential Fellow and Executive Director of Health Equity Initiatives for our campus. Also has an appointment as Professor of Practice in the Department of Pharmacy Practice and in Public Health. Dr. Adams, thanks for joining me today. And it's a few months in, but certainly welcome to Purdue.
Well, thank you so much. I'm still soaking it all in, but I got to tell you, I'm proud to be a Boilermaker.
Well, we're proud that you are a Boilermaker. So, because we know your clinical appointment is with the other institution to the south, but we're now proud to claim you as a Purdue Boilermaker. And really, as I indicated at the beginning, your title is around health equity. So maybe just talk a little bit about what your vision is for Purdue's role in health equity and in the state of Indiana.
Well, that's a great place to start. And I think first we have to help people understand what health equity is. And health equity is really making sure people have opportunities to make healthy choices, have similar opportunities to make healthy choices. And I'll give you an example. My daughter has been on her screen way too much, my 11-year-old daughter, as has many children across the nation during this pandemic. I can go out and tell her to ride her bike for a half an hour and not worry that she's going to be accosted or that she's going to get hit by a car, because we live in a neighborhood that has complete streets and where everyone knows her. A dad who lives 5 miles away from me in Indianapolis might not have that same opportunity to encourage his daughter to engage in healthy activities, because he may not have complete streets in his neighborhood. Dad may not have the ability to feel that his daughter is safe. And so we want to make sure we're using all the resources of Purdue University to ensure that people not only get great clinical care and health care when they need it, but to make sure they have opportunities to make healthy choices so that maybe they don't need that clinical care in the first place. And one more point I'd add to that, we know that from studies that about 80% of your health is actually determined by things that happen outside of the hospital, outside of the doctor's office. They happen in communities. And Purdue has many resources that they can bring to bear in terms of impacting those community opportunities for health. When you look at the School of Agriculture, when you look at the veterinary sciences that we have available on campus, when you look at engineering and the ability to impact access to healthcare through biomedical equipment, when you look at the Lamb School of Communication, so many opportunities to influence health. And that's really what health equity is all about. And that's what I'm excited about.
Well, as you think about pharmacists, and for those who don't know, Dr. Adams was a clinician at Eskenazi Health, served as the chair of Pharmacy and Therapeutics Committee there. So certainly very well associated with pharmacy as a profession, and was a great friend of pharmacy as Indiana State Health Commissioner. But how can pharmacists in the pharmacy community and the profession lift up a health equity in our communities?
Well, one of the things I'm most excited about at Purdue is to have an affiliation with the School of Pharmacy. As you mentioned, I was on the Pharmacy and Therapeutics Committee at Eskenazi for almost a decade and chaired the Pharmacy and Therapeutics Committee for much of that time. And then when I was Surgeon General, I actually oversaw the United States Public Health Service Commission Corps, and one of our largest categories of health professionals are our pharmacists. And in both of those roles, I really tried to leverage the skill sets and the touch points that pharmacists have in the community to improve health. I'm stating the obvious here, but many people don't think about this. The average person, even all of us, we go into a pharmacy, we have a conversation with a pharmacist in most years, far more than we have a conversation with a doctor or a nurse or in a hospital setting. And so that's a critical touch point that we need to take advantage of. When I was at Eskenazi, we really helped stand up collaborative practice agreements that allowed pharmacists to help with diabetes management and to help with anticoagulation clinics. And as Surgeon General, we had pharmacists who were in the public health service who were helping stand up medication-assisted treatment clinics in prison settings and in austere locations. So many touch points on the clinical side. But again, when you look at what we're dealing with right now, low vaccination rates in many communities, about 80% of people eligible for a booster still haven't gotten a booster. That's prevention. That's in the community. And while we want doctors to be armed to be able to answer questions, we know that a pharmacist and a pharmacy utilizing their touch point to be able to inform people about how to stay safe can be critically important.
I'm going to throw one other question at you that's a little bit off script, but I think it's a softball. So why Purdue? Why are you excited to be a Boilermaker, and why did you choose Purdue to be a home for you and to really to be a platform for health equity and public health?
Well, it's interesting because I will talk about that other institution that's a little bit south of us. I've been affiliated with them for about a decade and been largely in clinical roles. And as I mentioned, I had to start walking the talk. I was out there telling people that we need to engage in these social determinants of health. We need to get upstream. But I was continuing to work in a system where I could simply just wait for people to show up when they would already been hurt and try to patch them up versus preventing them from getting hurt in the first place. And so excited about all the opportunities. In addition to you, I've gotten to meet the deans of the School of Agriculture and Veterinary Science and Human Services. Wonderful, wonderful people. Dean Reed, Dean Platt, and Dean Underwood, who I'm excited to work with. But I also have to tell you that it's really exciting to be able to work for someone like President Daniels. And I've gotten to work for several governors or former governors, former Governor Mike Pence, former Governor Eric Holcomb. Didn't get a chance to work for President Daniels until now, but I can tell you his reputation is well known as someone who really, when he sets his mind to something, he's not going to let obstacles get in the way. And he set his mind to really making Purdue a national leader, not just a regional leader, but a national leader in the health equity space. When you talk about $75 million that has been allocated by the Board of Trustees and by the President for this initiative. When you look at a cluster hire that will ultimately be 40 plus people, and I'm proud to say I was the first of that cluster hire, but 14 of those positions coming up are going to be in the areas of public health and prevention. Gosh, how do you give up an opportunity like that when you've got the resources, when you've got funding, when you've got all the assets that Purdue brings to bear, and when you have a president who says, look, this is going to be a priority. So I couldn't be more excited than to be here at Purdue. And I'm really looking forward to working with many of our alumni, many of the people across campus to make this as impactful as it can be. Indiana's been ranked 41st for health for far too long. The United States has what I call a US health disadvantage as a nation. We spend more on healthcare than any other developed nation, yet we still have results that are far below the OECD average. So we've got to start doing things differently. And I really hope, I believe this will be an opportunity to change the paradigm to get us from putting Band-Aids on people when they're bleeding to preventing people from getting hurt and bleeding out in the first place.
Well, part of this is a dialogue, and I usually give our guests a chance to throw a question at me. Maybe you've got a question for me?
Oh, I was waiting for this. No, I wanted to ask you, how do you feel pharmacists and the pharmacy community can have a role to play in the health equity space? Because I know from my experience as a physician, but obviously you live and breathe this world.
Yeah, I mean, you've mentioned this to some extent, and that is our accessibility. I mean, I believe it's true that pharmacists are the most accessible healthcare provider in our communities. And so we've really got to take advantage of that. And I think over the last year and a half, pharmacists have been front and center addressing the public health crisis that the nation has faced. I'm not sure how we would have rolled out the vaccination plan that we did, and you were had a front row seat in that development of that plan. But our partners in our community pharmacies, Walgreens, CVS, Walmart, who really stepped up both on the testing side of things, but also on the vaccination side to get this country vaccinated, was really extraordinary. And 20 years ago, we were just getting started with doing flu shots in pharmacies. Who knew that we were laying the groundwork for what would ultimately be a critical piece in contributing to public health for the country by enabling pharmacists and student pharmacists and our pharmacy technicians to give vaccinations and do point of care diagnostic testing in our communities. And so we've got to think about ways we take this as just the starting point to do new initiatives and to new efforts to provide care in our local communities where people are living, and take advantage of pharmacist roles and work with our community pharmacy partners to shift away from just being distributors of product to deliverers of care. And so there's some really new and innovative approaches that we have coming online that I think will shift the burden away from that distribution role that pharmacists have historically played, and really put the opportunity to give care in our communities. And as I think about our role as a college too, and as a university.
I wanted to ask you that as a dean about, the particular, because I've gotten that question myself. It's not why Purdue, because I think it's easy to explain why Purdue as opposed to many other academic institutions, but the question is, why an academic institution? What unique assets can be brought to bear by being in an academic institution as opposed to embedded in a healthcare system or in a governmental institution?
Well, I think there's two real opportunities for us. First is our asset of students, and the second asset are our faculty who do research. And so first, our core mission is to prepare the next generation of leaders. These are going to be the folks that are going to take over for you and I in a decade or so to lead the way. And so our opportunity to train them to think about health equity, to think about public health, to ask the questions, and to make that part of their core value as a professional and as a practitioner, I think is really, really essential. And so our students who become those next generation leaders are going to be really critical to that role. Our land grant mission, it focuses on our impact in our communities. And so what is more important and impactful than health and public health? And certainly we bring education to the masses, but how that education ultimately translates to make our communities, to make our state, our nation better is really key to who Purdue is as a land grant university. We also have the opportunity, as I said, to do research. And so we've launched the Center for Health Equity and Innovation as part of this. They're doing a whole series of programs and projects to explore ways to impact health both in rural and urban communities, working with community health workers, working with the homeless, addressing those social determinants of health that you mentioned. In academics, we can perform research to understand the problem and then identify possible solutions to do those experiments, those social experiments, to see where we can make an impact. You indicated, and I was going to mention this, again, it's true, roughly 20% of outcomes in healthcare are linked to our efforts in clinical medicine. There's all this other 80%, education, diet, access to food, nutrition, socioeconomic status, where you live, the zip code that you live in impacts, your life expectancy. Purdue is very much a place, as you mentioned, with public health, nursing, agriculture, business, education, college of education, college of engineering, veterinary medicine, where we have a chance to look not only at that 20% that we live in the clinical medicine space, but also that other 80% and think about ways to address health equity holistically and hopefully make the highest impact we can in our communities and in the state, but become a model for the country as to how we can address health and make our nation a healthier place, which I think centers right in your heart as a former Surgeon General. So we're excited to have you here, Dr. Adams. So thanks for being with me today.
Hey, thank you so much. I really appreciate it. And I hope we can continue to have these conversations with each other and with everyone on campus and with many of our alumni about how we can turn Purdue into really a nationally recognized center for health equity. And I believe we have all the talent, all the tools, all the resources here to do it. We just need to channel all that energy into really some unique and innovative ways to drive impact.
Well, great. And we look forward to working with you and seeing where all this goes and sharing in the future the impact that your work and the work of others on campus is having in this space. Well, those who are watching, please feel free to comment on the video as well as provide any other topics you'd like to see us discuss in the future. As always, we thank you for watching. We'll see you next month. Hail Purdue and boiler up.